So welcome everyone to patient education session. It's one of 7 webinars that the Innovation Scouts have asked us to host. I just want to run through really what the Innovation Scouts network is and what that means to us before we move on, and obviously I'll go through some of the content for today. So we have got a couple of hashtags as well for you today, but some norm settings. So we're going to keep you muted until the question and answer section later, but we know that some people like to reflect on their questions, so we would love you to add it into the chat if you've got any questions that are going to come up as we have a conversation with Rahima Farah, who's our key speaker today. So we've got tweets information for you. So at innovation_NWC is the Innovation Agency's Twitter account, and we'd love you to use the hashtag Innovation Scouts. Rahima has kindly allowed us to share her handle, and mine is K Romaitis. The webinar will be recorded and the slides will also be sent out to you, including the recording via Eventbrite. We'll invite you to sketchnote and capture your ideas. That's always something that would be really great to see after, if you'd like to do that. And if you feel like you would like a specific conversation about any of this later on, you can always contact me, and we can also reach out to Rahima if we need to too. So today is the virtual lineup is we're just going to talk a little bit about the Innovation Network, and we've got Rahima, who is an advocacy link worker at Merseycare, who's going to share lots of stories and successes around patient education, how she approaches that, and really bringing the human into conversations to make sure that people are engaging with the information that we need to share with them. Really interesting. Me and Rahima have worked together now since she started on our Coaching for Spread and Adoption programme. And I just think it's amazing really to see how the transition has been from then in terms of Rahima's work, but also lovely to see that she's just been shortlisted for a diversity award and has been able to share with me some of the really heartwarming and integral contributions that she's made to people in the community of Liverpool. So we're going to have an opportunity at 12:30 for questions and answers. If you need to go, then you can leave your question and it'll still be answered in the chat. That's no problem. And then we're going to wrap up and close with some reflection and sharing. So the Innovation Scout programme, for those that aren't a Scout, you can sign up. You'll also get lots of education online from us, as well as entrepreneurial skill building, coaching and mentoring, and belong as part of our network. We also have 12 peer mentors within the Scout community that can help you to develop your projects or work. So it might be something that you would be interested in. Funnily enough, speaking to Rahima yesterday, one of our priorities was engaging hard to reach populations, and actually it was really great learning from Rahima around even just the wording of that and how important it is for us to rethink the accessibility of our services. Are they really hard to reach populations, or is it that our services aren't accessible? So we will be looking at that wording. It might not be accurate as that is, but that's what we're going to be looking at. And also from speaking to Rahima, I really did feel that it wasn't just about education for patients, but it also covers quite a lot of these things as well, including barriers to information sharing, including health and social inequalities. So I think we will touch up on a couple of the lists, the priorities from the list today too, which is great. We're so lucky to have Rahima here today. So just a little bit about the Innovation Scout curriculum map, where that will lead you to. So it'd be great for your revalidation if that's something that you have to do, but it's also going to be really integral for you to learn what innovations are coming up or what's currently happening within the system. And we really look to have very good keynote speakers that potentially you wouldn't necessarily reach in your role. So just a little bit about where we're going to be up to with our curriculum map. I think mine has just frozen. It's okay because I'm going to stop sharing anyway. How's that? So I'd like to invite Rahima to speak now, and I'm just going to start off with a few questions. So as I say, I hope that everyone uses the chat function. I'd love you to get involved. This is really a collaborative session too, so please offer out any questions that you might have. So Rahima, are you okay to unmute yourself there? Let's have a look.
Yeah.
There you go. Hi Rahima, thanks so much for joining us today. So we're particularly interested in patient education, but I was just wondering if you could introduce a little bit about your current role, what you do, and potentially how you got into that.
Right, hi, my name's Rahima. I work for Merseycare, as part of the social inclusion team. I've worked for the NHS for 17 years now. My role when I first came into my post was to work with women who had FGM, which that's female genital mutilation, to educate them around the new law that came out, working with families. I also work in the Liverpool Women's Hospital, so I used to support the FGM survivors, the ones that have had the operation and wanted support after. The reason why I came into my role is I absolutely love working and supporting people. So if I wasn't doing my job, I'd be doing it anyway, and I'd be doing it for free. I love empowering women. I love just letting them know, that you can be the better person of yourself, and just giving them the courage to go out and get the right support that they need, whether it's in education, whether it's around your health, financial support, because a lot of women that I work with, they really haven't got confidence, to know what their rights are. And when you direct them into the right support, they feel empowered, and that's one thing that I encourage. The main thing at the moment is that we work with like asylum seekers and refugees, because we're the first point of call to register them with GPs. So obviously with an asylum seeker, when they come to the country, they don't have any access to anything, so we support them to get registered with the dentist, GP, but also with the women in the community who are marginalised. They need the same support because they don't know where to go to access. So just supporting them that way.
Yeah. What influenced you to take up that role? We were speaking about your mother last time we had a conversation, and how that sort of really transformed your family, really, that support.
Yeah, when my mum came to the country, she came to the country when she was 13 years of age, and she couldn't speak the language. She had no support, so she had to learn the language. But in between that time, we had a lady that came to support my mum, who used to read her letters for her, fill out the benefit and support her. And my mum, she really used to speak highly of that lady, because if she didn't have her, obviously we would have been in debt and we would have had no support. So whenever my mum went with any issues, it's like she took all her problems away. And I feel like that I'm that point in Liverpool, is that people come to me with any problems, whether it's benefits, health, school, and I support them to get the benefit, to get the better outcomes. Because if they didn't have me, where would they actually go?
Yeah.
For the language. I'm also every different community have different ways of getting support. Like with the Somali community, they don't actually read their own language. I always say this: the language came out in the 1970s. So when people write, translate information, it's like a tick box exercise. So they'll fill it out and translate it in Somali, but people can't actually understand that. And the only way to get these messages across is through verbal translation. I'm sort of the key in getting these messages across to the communities, that they would necessarily not get that information.
And so could you give me some examples of the work that you've done that's really transformed some of this patient education? We've spoken about the smear work that you've done, and also about where you've actually met people that are patients of yours, to get them engaged, how you've worked with them.
Yeah, so I go into all different community settings. I'm very well known within the community leaders. So I'll go and identify the barriers. What, like you were saying, they're not hard to reach. Is that the services we need to come in there and provide the service to them and come into their communities to help reduce health inequalities. Otherwise, a lot of this information doesn't get passed on. The work that I did around smears is I've done loads of events, but one that I did was for women, and I did it of an evening. So they had no children. It was just a lesson that was focused on their health. And we covered bowel screening, cancer awareness, smear. And in that meeting, we had, I called it a ladies' night. We had GPs. So we did like a Q&A. So, and some of the questions that came out of that session was, like I was saying before, I was scared that I might lose my virginity if I had a smear, or some of the women were like, or I won't get it because it's only for women who slept around. And that education, it stopped them from getting a really important message. So when they heard it from the GP, it was very powerful to them, thinking, oh, all these years that I've not had my smear and all these things, it doesn't break your virginity. And it doesn't, you know, it can happen to anybody, showing them examples. So we had a bigger uptake for the smears in our GP practice because of that. And what upset me was these vital messages, you know, they're so important to get across to the communities. Even when I was talking about the gypsies community, it's the same thing. A lot of the letters that go out, they're very, you've seen the letters for the smear, it's very generic, it's got a lot of wording. And how can that, someone who can't read or illiterate, how are they going to get these messages? So it's important that we take our information into the community, run focus groups, ask the women what they want. How can we empower you? What are your needs? You know, for instance, I feel like I ran healthy keep fit sessions because I did a focus group on women, and they said all the gyms are mixed. We find there's no women only sessions, so we put on sessions for them. And then I left the session to run itself. So now their own keep fit session, it's not just about putting on a service. Everyone puts £1, £2 in the jar. It pays the instruction, and then these, you know, we're supporting women in all aspects of the community. But you don't have to be there. Once you've empowered them, you've run a session, you can then leave. With the
so that sustainability, isn't it?
Sustainability.
So yeah, making sure that what you're putting in place, they can run themselves. Yeah.
It's so important not to think, oh, I'm going to be at this session forever. No, put the session on, focus groups, speak to the women, ask them whether it's men, women, what are your needs? What do you feel like? What can we provide to help you to, you know, improve your health? And, you know, in these focus groups, it's very relaxed. You can do them anywhere. You can do them in schools. I've run mine in the Sure Start centres, in the community settings. You can go into churches, mosques, wherever you can find a group of women and ask them.
Yeah. And you know, so that takes time, Rahima, as well. And one of the things that we were talking about is how you've actually developed trust as an advocacy link worker. You know, so how do you feel that you've been able to do that with the community that you serve?
It's building the trust, but it's also delivering what they want. And don't be unrealistic with your expectations. Don't promise things that you cannot deliver. You know, only do things in your capability. I'm not a doctor. I don't come from a doctor background. So in terms of medical, I can't personally give them that advice, but I will bring medical staff in to give them that advice. So for instance, around the diabetes, we have in the BME community, the Somali Yemeni community, we've got a high risk of high blood pressure and diabetes. So I spoke to the women and I asked them, how do they feel if we ran a session around using the blood pressure machine, so they didn't have to go to the doctors just to have their blood pressure.
Yeah.
A lot of women in their own country, you know, are educated. you know, they can speak the language. But in this country, because they can't access the language, they're not illiterate, how can I put it? They're capable of numbers. They're not stupid, but they can't understand the English. So once we translated the information for using the blood pressure machines, we actually trained 12 from the community who are bilingual, you know, to go on and train as blood pressure champions. So they can go back into their communities, and when they run little sessions, like health sessions, they can take blood pressure and they'll know whether it's high or low, and then they can pass it on to the GP or nurse and then say, but to test them, a lot of women were scared about not knowing how to check their own blood pressure, but they were capable of doing it, and we successfully trained 12 people, and now they feel empowered that they've got some control. And one lady said, sorry, yeah, one lady,
what did she say to you?
She tested her whole family, and now her and her husband, she can take her and her husband's blood pressure.
And what impact has that had on the NHS? Do you think the fact that she's now being able to do this, what impact do you think it's had on our services?
Oh, it saved cost. It saved cost because a lot of these people were going to the doctors or the nurses, booking appointments, and now they can test themselves. And if it's high, then they need to seek help. And we train them in that, because I linked in with somebody from the digital team, and because I was on the course, social prescribing coaching course, and I met someone who works for the digital team, and we linked in together and we did the project together. It was a need that I came about and realized that the digital team offered this training. But my concerns was the barrier in language. But then we got translators, and they were all trained. They understood the information.
Yeah. And there's another thing that we spoke about in terms of identifying language barriers and things that we could actually do to encourage and to offer out to people that don't speak English as their first language. And you were talking to me about the courses that you know that are widely available.
Yeah, I think it's important to, like, for instance, if you empower women to understand the language. I was saying to Carly yesterday, when my mum came to this country, she couldn't speak a word of English. And she said, you know, it doesn't matter how much you go to the GP, sometimes you want to tell them yourself in words. And back in them days, they used to use cards, you know, to show like pain or you got a headache or stomach pain. And she said, you know, not having your point across in your own language, she said it was awful. And she made it her statement to go and learn the language. There's a lot of ESOL lessons, classes that are available. And I think, you know, empower the women, say to them, look, do you want to go on training? Do you want to go and learn the language? And a lot of them do, but they just don't know how to access this. And I think it's up to us as healthcare professionals to say, to give them that information and say, no, you can do it, and to book them on. So that in the future, that will save the NHS a lot of money. Because
are they free courses, Rahima, the ESOL lessons?
The courses, and ESOL classes are free. And it's important to get these out for people, and we encourage, like, I've got women that used to come to my classes that never ever spoke the language. Now one of them is trained as a classroom assistant.
Brilliant.
In college, she learned English, and you know, when I see her, she's beaming, because she's into society. And before, she used to come and she just, even though I could speak to her in her own language, she didn't feel a part of society. When you're working and you're paying your taxes and your family, she said she feels like she's home now. Mm-hmm. So it's really important that we send these positive messages to the community.
And so in terms of your work around identifying different communities, we had a conversation about, you know, that not only will you work with communities within their own cultures, but you also bring these communities together.
Yeah, because it's so important. I always say, you know, they've got a lot in common. When I put on sessions, I put it on for everybody, and I love to see the mix of diversity. And they always find some common ground when they're together, and it's really important. I was saying about the case report, is that bringing different communities together is very, very, very important, and understanding each other's cultures. Like I used to do a walking group in the community, in the GP practice. And in my session, I used to have English, Arabic, Somali. Some of them couldn't speak the language, and they all got on. They all spoke. It's strange how, you know, we all went out to the walking group. We all sat down. We all had a cup of tea, and you know, the women used to open up and speak to each other, and they always found a friend. Like I've got women now that have come to the group that they now meet outside of my class, and they never would have met before. So I think it's important that you don't just stick to different communities, and that you try and do sessions for everybody and put them into work from GP practices, or work from the Shore Starts, or communities where everyone can come together and empowering all the community.
So we spoke a little bit earlier about the fact that you are shortlisted for a diversity award, and I was just wondering, because we spoke about some of the comments, whether you have any of those in terms of the impact that your role has had on people in your community, and what type of feedback that you got from them.
Oh, it was amazing. Honestly, I just said, even if I don't win the award, reading, I got over 270 people writing things, and honestly, my eyes welled up. Just, you don't realize how much the impact we're having, you know, supporting people. And a lot of the women, like one lady wrote, she came to my session and she lost a hearing aid, and she was going on holiday the next day, and she said, and she was from the BAME community, she was deaf, and she seen me in the hallway of one of the GP practices, and she said that I helped her find a hearing aid, and she said she needed a battery. And she was like, what, if you'd have just walked past me that day and just said hello, you don't realize how you changed my life. I would have been on holiday and wouldn't been able to hear a thing. Just some of the women, the comments of how, you know, I've supported their whole family. Obviously this lady couldn't speak the language, but her daughter wrote it, and it was like, Rahima supports my whole family. She's my mum's go-to person for anything in terms of education, benefits, support. She supported my mum when my father had a mental breakdown, and she never said no. And it was, obviously her daughter wrote it, and she was like, my mum said she would be lost without her, and she's not just only a colleague now, she's become part of the family because so much. I'm there helping them so much. I feel like part of the family. And just like health professionals as well. I was talking about the immunisation and how I work with the immunisation lead, and she actually won an award around the BME community. She wrote something around that. I supported her, and we went from, the school went from 3% uptake to 33% uptake, because of my engagement within the Muslim community, the BME community, the trust that I built up. It enabled her to get her results. And these women, and she just said she couldn't thank me enough, and how my role is so important, because obviously she never had that trust within the community, and I'd already built that trust up, so it was easy for her to come in, and she felt very welcomed.
Do you find, as part of your role then, that are they patients, Rahima? Is that how you?
Patients, clients.
Do you find then that your patients may bring you information from other healthcare professionals and ask you to support with that?
Definitely. And, you know, they'll send me letters. They get letters from mammograms, they got letters for bowel screening, cancers, wherever I am, you know, even if people stop me, even in the Asda, wherever, and I'll support them, you know, and maybe not.
Someone chasing you for a letter, with a letter in the Asda.
It's true. It's true. I have. My husband's give up on me now. I get the plot.
So do you think then really it's about not only sort of you build them knowing where to go, but you also knowing them? And how do you build that relationship with them, Rahima?
It's just, like I said, it's important to trust your clients. To trust for us, because obviously I work for the NHS and I'm bound by confidentiality. Anything that they tell me, they know will never get repeated, because obviously I work for an organisation. I wouldn't do it anyway. but they know they can tell me anything and know that it'll never be repeated. And I think years of work in the community, by now, someone would have said, oh, Rahima said this or Rahima said that. Communities are very small, and people would say, but they know whatever they say to me, they've got trust.
Mm-hmm.
And it will never, only themselves and me will ever hear about that information.
So how do you share this information with the wider networks? Does this information, so all this sort of social, I love Chris Carlin's term from Halton CCG of social prospecting. So, you know, you're going into the community, you're prospecting, you're finding those really golden people that would support other people. How do you then identify those, and how do you share that with the wider networks, the hospital trust, for example, or health and social care professionals that really need to engage with some of these people that you've already got a good relationships with? How do we learn that from you? How do we get those key bits from you?
Yeah, it's just, you know, it's bringing, like you said, bringing the services into the community and them seeing the results. Every year I do an annual diabetes awareness session. I bring in all the diabetes leads for the city, because each GP has a named diabetes specialist. So we have 7 members of the diabetes team that come out into the community. We do it like a Q&A. I do it around Ramadan time, you know, Ramadan, because a lot of people choose to fast, and you don't have to fast if you have got a health issue. So I always make sure that we tell them about that. In them sessions, we tested for diabetes and high blood pressure, and every year without fail we get around 30 people to 40 people who have got undiagnosed high blood pressure and diabetes. So even for the nurses, that is feedback for them, because they obviously have to take these patients on as clients for them, and they can see the impact that it has. So they come to me now, and we've built up a relationship, because I've been doing it for the last 7 to 8 years, and every year we find people who are undiagnosed. So there is a need. So it's still showing, the messages are still not getting across.
Yeah. What do you think is one of the biggest challenges that we face as health and social care professionals, making sure that our systems and our services are accessible?
Yeah, it's making sure you come into the communities to deliver the information. You know, like I was saying, we're not hard to reach. It's just that they can't, they may not be able to read the literature. They don't know what's available. You know, they don't know if they can't read a leaflet, then you're making it unaccessible. So you need to bring the services to them, or provide translators like for them, so that they can get the information. So from learning from this session, I think it's so important that you go into different communities, you understand their needs of their communities. Every single community's got a different way of accessing information, and finding that out. So for instance, like the Chinese, they use like a WeChat, it's like a Facebook. So you can maybe be able to access that to put in information for them. And a lot of Chinese actually read their own language. So yeah, you know, putting things into translation for the Chinese community, they could get the messages. Yeah, Arabic community as well, they can read the information. But it'd be good, you know, to deliver it to the communities as well. So yeah, understanding the community, making sure you're making it accessible to everybody. If you find that, you know, communities are not coming forward, maybe run like free workshops, focus groups, and then from that finding, you'll see people will open up.
Is there any thing that would draw people to a focus group more? Because I know that you said that you provided, you know, lunch and the time.
Yeah, definitely.
And these are small things, aren't they? But if they make a difference, what do you think has been your most successful focus group to date, and why do you think that?
Refreshments. Oh, that's a must. No, I think it's nice, because when you have a cup of tea and a bit of food, everyone starts talking.
Yeah.
That's when they you know, and we save the we let them eat, and then they start talking. We put a few key messages out. For me, I put a lot of key messages out. I'll do a PowerPoint presentation telling them about what we're doing, translate that into the languages. Then we'll provide lunch, and then we'll deliver the session. So if we're doing a diabetes session, everyone will get tested, give them information around the signs and the symptoms. My most successful event for me was the cancer awareness one, because I felt there was no children around. I think a lot of my community have got a lot of children. So I told them that day, your husband's having the children. With no kids. This is all about your health. And I did it around, so when the children come back to school, I did it from 5 to 7. And then we had the doctors there, like I said, we did the Q&A.
Yeah.
And we had an uptake for Samia's, and it was nice. A lot of women came up to me, and like one lady, she was like about her mammogram and how she can get it done, and she's never had one, so I supported her to go and get that. And a lot of women went on to get the smear, and they felt confident. I said, Rahima, if it wasn't for that session, we wouldn't have had it done.
Mm-hmm.
So that's the key. The key thing here is, how are we going to support our community and engage with them to help reduce health inequalities? There's no point just letting it be a tick box exercise and filling out a leaflet. But how are these messages getting across, and are they doing what we say they're doing? And the only way to do that is by speaking to them.
So I've just got a final couple of questions, because I know I've just been firing them at you, but I'm just so interested in your approach, and your passion just comes across. It's unbelievable. But I'm just wondering, with COVID-19 now, how has that affected your work in terms of patient education? How has that affected members of the community that you know well?
To be honest, right now we're not doing the work that we should be doing. Our work now is all online, on the phone. But I know, in terms of mental health, is rife, obviously, with women anyway, BME women, and like I was saying, around not being supporting the families and with the homework, and a lot of these women can't read and write, they're illiterate, and a lot of women who were like anxious about not being able to do the work. But in terms of COVID-19, I feel like there's going to be a lot of work to do afterwards in terms of mental health. That's a really big thing now in the communities, and support and engagement back into the community. How are we going to engage these people back into the community? Because a lot of them are really scared.
Yeah. And so probably an even more, are you saying then an even bigger drive in terms of
definitely
outreach?
No, we're going to have a huge and for me personally, what I want to do is I want to start with the focus groups again and ask them how we can build our sessions back up and what they feel they need. It might change from a coffee morning to more of like anxiety workshops. You know, I'm looking at running like anxiety workshops, you know, to support them with their anxiety. We're going to have to change what we did before and move now because of the COVID-19 and how we're going to support the women. And that's one thing I'm looking at, is doing, you know, anxiety workshops and bringing specialists in to work with women, because a lot of them are suffering from anxiety and stress due to the whole, and that's from speaking to them. But these are things that I will put on after, because mental health is so important.
Yeah. And where will you look for support for that, Rahima, in terms of, you know, obviously social prescribing is a very big part of what you do.
Yeah.
So how do you find social prescribers within Liverpool? How do you know what's on offer within your local area? And do you think, well, that's one question. So how do you find that? And how could these services offer you more support or better awareness of what is actually out there?
No, you know, I have a very good working relationship with a lot of organisations in Liverpool. You know, I'm on a lot of groups. I attend, you know, different groups. I'm very active on Twitter, very active on social media. So I get a lot of information sent to me about what's available. So it's not only signposting them, it's maybe going with them. Some of the women might be scared to attend the first session, so I'll support them with that. So yeah, it's very important that you know what's available.
Mhm.
So do a little map. I always say, a lot of services now are going to be cut after the COVID-19. There's things that were available before, that they're not available anymore. Like Livewire is gone now, and that was a very big organisation in Liverpool that supported a lot of the marginalised communities. So it's finding the services available.
Mhm.
You need to do, we all need to, and if it's one thing that we can take from my session today is look at what's available in your community. Look at what services available that work with the community to, that support people around health, and link in, because not everyone can do everything. I link in with different organizations around education. A lot of my women, they struggle with their teenagers. Once they finish school, they don't want to go on to college. So I've got a good link in with someone from who works with children between the ages of 16 to 19. And she helps them with education, getting back into the to training. And that's helped these women, because a lot of these women are anxious. Oh, my child's at home, he's not going to school. So I take that stress off them by signposting them to someone that can support them. I'm not a specialist in working with people in terms of education, but it's asking your community what's their stresses, what's their worry, and linking into different services and doing a little map.
Do you think it would be helpful if that more social prescribers approached you though, or made themselves even more available for you to know what's out there, rather than looking at social media for your referrals? Maybe if there was a method in which they came to you and said, this might be something useful.
Yeah, no, we're available. People know how to access us. Social inclusion team, there's a form. If you email over, they'll send you a form to fill out for referrals. But what if I can't help them? There's other services out there, and it's working together now. There's a big drive on link workers. And as a link worker, I do feel it's a duty for you to find out what's available in your own area.
Yeah. And these link workers, so you cover 10 GPs, is that right, Rahima?
No, I'm an advocacy worker, and I work across every GP.
Every GP.
Anyone can come in, but we've got link workers now. Link workers that work with specific GPs, and I don't know if there's a few on here that are link workers that work with specific GPs. How can they link in to their communities to identify the barriers and the needs of their community, and how they can link in with the likes of me? They need any advice or guidance.
And we were talking earlier that healthcare professionals can get in touch with yourself and people that do your work through a referral through the social inclusion team online.
Yeah.
So if they would like to work with you, or have
definitely.
To help
to pass on my details. Yeah, definitely. And if they want any ideas on how to run groups or how to support different communities, email me, and I will support you in any way that I can.
That's fantastic. I think I'm sure we've got lots of questions as well, Rahima, if you're happy to take some of those. So I just invite you all to raise your hand if you'd like to ask any questions, or to pop it in the chat, and we'll go through those. We have had some questions already around some comments really around hard to reach. Most NHSs across the country don't use hard to reach. How do we educate all? These groups aren't hard to reach, you just don't know where to work with them. PPI work helps to rewrite and reform patient leaflets. So I'm just wondering, with that, are you involved in any PPI groups, Rahima? Do you get involved in any patient and public involvement?
Yeah, but I'm on one. And that's one of the GPs that I used to run a walking group session in. So it was important that I fed back into and explained to them what I was doing.
Do any patient and public involvement groups ask for your support, or advocacy link workers support specifically?
Yeah, definitely. Yeah, it's important. And I believe that if you're working in a GP practice, you should be a part of that group to let them know what kind of patients you see in your sessions, how you've empowered them. It's nice to bring that back to them and say, look, I did this. This woman was extremely isolated. A story, I had a lady that was coming every day with her antibiotics. She'd come to reception. She couldn't speak a word of English. She'd just come in. But that was it. When we got down to it, that was her only engagement.
Yeah.
She was living at her home with her grandchild, who was a teenager. So she had no engagement. So she used to come to the GP just to have some engagement. And then she came to my group. And then she stopped doing that because she used to look forward just to be able to sit in a room with other women. And she just...
It's that social isolation as well.
Yeah, social isolation is, yeah.
So not even just talking about patient education, but actually, you know, picking those little bits of information up, I'm guessing, within these social community groups as well.
Yeah, but social isolation is really, really big, you know, and it's important that, you know, you go and try and find out who is isolated and support them to access. And GPs are aware of those who are isolated and maybe run sessions to support them. To leave the house.
So Dave's here with us today, Dave Dewhurst. He is our Patients and Public Involvement. What's your title, Dave? Patient Public Involvement Officer. Yeah, officer. And Dave, just what I would like you to see what you was actually really active on the chat. It'd be nice for you to actually speak about that, if you don't mind.
Yeah, that's all. Yeah, I was actually just typing a question, so I'll delete that now. One of the things I was curious of, obviously we use a similar approach to try and work with willing community members to build that trust initially.
Yes.
And then the idea again, which I think you mentioned, is that then the community sort of takes over and you become a facilitator of their need rather than sort of imposing what you think the community needs on top of them. How do you personally identify community members in that initial stage to sort of kick off the relationship? Is there any particular way you do that?
Yeah, I just go into their community settings. So go into their social gatherings. You know, like I used to go into the mosque on a Friday prayer, which is very busy. And when it finished, we did like get some tea and biscuits. And then they start talking, go into different communities and open the session up. Don't make it serious. Just say, I'm coming to have a chat. That's how I say it. Chat. How do you feel about this, and then they start speaking up. How do you feel about the education system? How do you feel about your health? How do you feel about your housing? And then people are, oh, I've got this problem. I've got damp in my house, and we just like have a conversation, and from there we speak. And maybe I might help them. I might help her with the damp in the house, and then I've got a contact there that I can go back and speak to her and support her. And then once she's got the damp, she'll come back to me around other issues. So it's not health. Like I always say, it's not just one thing. I always look at the holistic approach, look at the health, look at the education, look at the schooling, look at their family life, and work with the families to empower them in everything.
Yeah. So am I right then in saying that it's not actually going in with an agenda to speak to them about one thing? It's actually just asking them, how are you?
Yes.
How is it? And then really letting that flow, letting that build a conversation, not going in wanting to tackle diabetes or this or housing. It's just about literally opening up a conversation and seeing what comes from that.
Yeah, and sometimes, Dave, I get in a bit of trouble because they think that I'm environmental health. I've been called everything. I think I'm an environmental health expert. I think that Rahima can deal with anything. From a school appeal, I had one lady crying because her child didn't get a school place. And I said, oh, don't worry, I'll help you appeal. Now I'm down as the person that can appeal and help win appeals because I won her appeal because her child had special needs. and she was really, that day she was literally broken. And I thought, how can I support her and leave? I can't leave her like this. So I ended up taking that on. And we won the appeal, and she actually wrote a message for me, and in that, it was, Rahima was not only my advocate that day, my child, I was very vulnerable, and she was she was educated, and she said she felt vulnerable because she didn't understand the system. So yeah, I just support them in anything.
Yeah, I couldn't agree more with both of those points. I mean, specifically coming at it from a non-agenda based sort of angle. Because in a former career, I was a trainer, and part of what I did as my job was second stage ESOL training. So when people had kind of basic conversation down, they'd come to me, and we'd build on top of that. And the best way of getting those conversations started was sitting down with a cup of tea.
Definitely. That's
telling everyone in advance, bring lunch with you, and we'll share it all out between ourselves, and we'll share different aspects, because that was a multi-ethnicity, multi-community type of setting. So everyone's sharing little bits and pieces, and it's easy to start that conversation then. And it's amazing the directions it goes. But go on.
You're right there, Dave. It's so important just to keep it natural, keep it flowing. Ask them how they're feeling, and like Carla was saying, I never have an agenda. I just go in and think, oh my word, what have I let myself into today? Some days I leave and I'll have one or two things to do, and some days I've got a full paper. I'm left with about 20 referrals. So it's so important just to be relaxed, and they love, because obviously I wear the NHS badge. I've been called Dr. Farah. Like, I'm not a doctor. Yes, Mrs. Farah, doctor. And I'm like, no, I'm not doctor. But, once they see you with the NHS, you can get called anything. And I just keep it relaxed and just say, let me know how you feel. And they do open up, like you were saying, Dave. People open up and relax, and especially in their own environments. And when I'm going into their environment, into their communities, and asking them, what do they want?
So we've got a question from Karen. Thanks very much. So they want to know, and I've asked this question, Karen, believe me, how many Rahimas are there across Liverpool? And I know how many advocacy link workers, but I'm sure there is only, honestly, you're so special, Rahima. I'm sure there's only one you, but how many link workers are there across Liverpool? And they also think, how many are needed, do you feel?
Do you know, we definitely need more. We definitely need more. Definitely need more, because we're taking the pressure off the NHS. I feel that what we do in working with these communities, because, putting on sessions, I was saying about, the importance of social prescribing and how it benefits the community. They get positive health outcomes, better emotional well-being, better mental health, better general, they get general better well-being, less depression, less anxiety. They're gonna go to the GPs less. If you're empowering them in their own communities, they've got somewhere to go, somewhere to talk to, somewhere they can let off. They're gonna have less time to go to the GPs. Because a lot of them feel extremely isolated.
Yeah. So we've got a chat mention from Capilla. I hope I've said that right. Is this Innovation Scouts Liverpool area or other areas of the country? So Rahima is obviously from our Liverpool side of where we cover, but the North West Coast covers Cheshire and Mersey and Lancashire and South Cumbria. And I was actually speaking to you about this, Rahima, before, wasn't I? Whether there are advocacy link workers in other areas, and do they actually connect with you? Have you got sort of a support network with other advocacy link workers, or are you really isolated there?
Yeah, we was the first in the whole of the UK to have a BME. We are the only BME advocacy workers, link workers, health link workers in the whole of England. We are the only organisation. Now there is link workers that are based with different GPs with different networks, but we are the only ones who are BME, and in the whole of the country, and we was the first as well. Obviously, since July 2019, with the launch of social prescribing, this is something, like I said, is so important. I've always done social prescribing, like you were saying, Dave, working with different communities, going out and supporting them with all aspects of help. That's social prescribing, and that's something that now is, you know, there's a big buzz now. Everyone's like social prescribing, but that's what I've always done. You know, you look at an individual, and you have to look at the whole issue in order to help that person. It's not just.
I'm just. Yeah, Karen's put there used to be community development workers nationally.
Yeah, they were different. Community development nationally were different to link workers. They were working with the community developments were working with people around mental health. They used to develop services. They were different to what we do.
Yeah. So I'm just wondering if we've still got quite a lot of people on the call as well. I'm just wondering, one of the questions that I'd like to ask and get some feedback for Rahima about really is, what have you heard today during this session that is going to be really invaluable to you in the way that you may take things forward? So I'd love you to put your message in the chat. So what have you heard today? I'm going to give you a few minutes that you think that you will take forward, or that you'll sort of be able to implement in yours. Or it could even be something that's actually you know, saying to you, well, I am doing the right thing, this is what we do here. What are those little bits of Rahima's story that have resonated with you? What might you retell to others? I'd be really interested to see how this will land. And then I've just got a few more questions for you, Rahima, as well. Once we get this feedback, just really about how your approach can translate for other health and social care professionals when they're seeing their own patients that aren't in your capacity, that aren't you know, doing this. That's one question that I'm going to ask you once we've.
Can I say one thing as well? You know,
absolutely.
A lot of the older generation, they work like presenting a lot in the hospital settings, and I've worked with a couple of the patients who we were just going to the hospital, ringing 999, going to the hospital, and how we could help support them to help them not go to the hospital, because it wasn't always a need. And some of them, when we spoke to them, they were just isolated. You know, going to the hospital, they had that contact.
Yeah. So it's sort of like using that for, you know, that is the wrong thing, isn't it?
Oh, by the way, thank you.
So Molly's put that she's learnt really it's just to have a chat, and that there is so much valuable information gained in general conversation. I suppose with that though, I'm wondering, you know, oh brilliant, so Xperia XA, I don't think that's your real name, but she's put, although she works in MSK, she's written down your brilliant ideas, and she thinks it's going to be really useful for her patients and for the service. Dave said that empowerment is the best form of prevention, and prevention is better than cure. Listen, act, build and allow communities you serve to lead your actions, rather than, again, it's like having that agenda really, isn't it? Get rid of that as much as you can to a point, and you know, see where that conversation leads. It's our responsibility to find appropriate methods of communication with BME groups and communities. It is absolutely our responsibility. And that leads back to when that discussion of hard to reach, it leads back to, you know, how accessible are our services, and what do we need to do to make them more accessible. Karen said that you're doing a great job, Rahima, and I've known about it for ages. It's frustrating, it's not everywhere. We do need more link workers for all the groups who feel not listened to. So my question to you, Rahima, is so for example, I may be a healthcare professional. I've got the pressure of 15 minutes with a patient if I'm lucky. How do I then open up that conversation enough to make sure that I've built that trust? How would you deal with that time constraint? Because I'm guessing that a lot of what you do requires a lot of time as well to get to know people. So what would your advice be to me?
I would say in that 15 minutes of time, just ask them, how are you? You know, they come in and they're like, oh, I've got this issue, but how are you? How are the children? How's the family? And then they might open up, and like I said, around the children not going to school, that might be a stress on them. Just make them feel, you know, that you've got that, because a lot of professionals are very busy, and I understand, but really, like, stop and listen and really look at them and say, you know what, this is your platform, this is your time, and I'm gonna listen to all your concerns. And when they're speaking to you, for instance, give them solutions, because I find that, you know, like I said, when you speak to them and it's like, oh, I've got problems with, you know, my child, you know, my husband's not working, you know, I've put on a lot of weight. They come with so many questions. You're like, oh, 1 minute, let me write these down. I need to break it down, because so I don't forget. And then, so what I do is I listen to them, and then I make notes of all the concerns that they have, and then I try and deal with them one by one. I might not be able to do it at that time, but I will make a note of that. And if I can't deal with it, then I will signpost them to the service, and then I'll follow that up with a phone call to say, you know, I've referred you over to this service, you know, in regards to benefits. Have they supported you? If you require any, you know, and I deal with it. So when they come back to me the next time, half the problems that they had are resolved.
Yeah. Andy Kearns mentioned before, he's from our innovation agency, from our commercial team, about Elemental, the platform for social prescribing, and asked, do you use that?
Yeah, well, we're a part, we use something called EMIS. No, I don't use the Elemental, but I've not been trained on it, but I'm getting trained to use Elemental.
Yeah, and that's a platform for lots of social prescribing offers, is that right, within the area?
Yeah.
And if anybody is interested in that, we do have connections with Sonia from Elemental. So if you do want to know more about that, then you can let us know. Capilla has said that she's noted a few points about cancer screening programs, especially how to provide information which answers their questions, apart from the good and bad points about screening. Again, that's such an important part of communication. Are we answering questions that we think they may need to have answered, or are we assuming that, or are we actually listening to what their questions are? So it's so interesting. And like you say, you know, you had questions, Rahima, that you didn't think would come up in a million years.
I know, I was shocked, but we got there.
And Gemma's written that she agrees. Usually the most useful information is how you gain from patients is just asking, how are you? You can ask all the targeted questions you want during consultations, I'm guessing MURs, but that seems to get people to open up a lot more in the questions that you're going to ask anyway. And I think one thing about you, Rahima, that really strikes me is your authenticity around what you're actually doing there. So you're authentically there to really find out about what people need and how they need to be supported, and I think that's a really important part of your personality.
Yeah, and someone wrote on my thing, Rahima always gets the happy ending. I thought, did I say that to her, or did she just write in there? But you know, I want to see it through, and I want everyone to feel empowered, and I want to make sure that we support everyone and their families. You know, it's so important to work together. And one thing that I'd love you to get from this session is that, you know, use your tool as working for the NHS. And when you go into these communities, really show them that you care, because a lot of services, it can become just a tick box exercise. And that's going back to the trust issue. When you go in there, you have a cup of tea, you just relax and say, I've just come here just to meet you all, see how you are, how are you feeling. Keep it very informal. You know, like you were saying, Dave, you don't need to go in all, you know, with a pile and hand over. Keep it very informal, and then you'll get your answers in a very informal way, and the more likely to open up.
That is just so me though, you know, preparing with like a big bunch of leaflets and going in, you know, ready, you know, with like something that I need to tell them about, rather than really thinking, what do I need to listen to?
Yeah.
Replace the leaflets with a box of Mr. Kipling's and you'll do fine.
Or, you know, something a little bit more healthier, maybe.
well, I've been told we've got to bring fruit, so I bring the fruit, but I also tell someone to bring the biscuits. Win-win.
Just one last thing that I've got that's curious, if nobody else has got any more questions, which obviously you can raise your hand and you can speak, we'll unmute you, and please put it in the chat. But obviously we are going through COVID-19 now. What elements of your role have you had to be flexible with? How have you changed to adapt to COVID-19, Rahima? How have you carried on and adapted to that for your patients?
Yeah, a lot of our work is online now and just speaking to people. But like I said, it's been so hard for me. I'm a people's person. And the reason why I've been in my job for 17 years is that I love people. I love being out there. I love talking. I love engaging from the old to the young. You know, I can have a conversation with anybody. And I really find that hard at the moment. And I've been cooking for a lady who's 92. And she's so cute. And we've done a lot of rota for her. So every day everyone goes. So I go on a Tuesday. And I just feel like that engagement, because she's isolated, she can't leave the house. And she calls me a Tuesday friend. And it's just, you don't realise how much she gets from that session. You know, me going in to delivering the food. And she said, Rahima, I know once you take the foil off, it's time for you to go. Don't take the foil off. Don't take And I was like, but you don't realise, for me, it's like I'm finding it hard, extremely hard. And I'd lie if I wasn't saying that. I find my job is going into the communities to support them and engage. So it is really hard at the moment, having to change my line of work and doing it online and over the phone and not having that visible engagement. I find it extremely, extremely hard. So I don't know how it is for other people. But yeah, it's been hard for me.
Kelly has asked, how have you found it best to reach the really isolated, especially older adults?
Do you know, we've been working closely with you know, the food, you know, because obviously we deliver food to the elderly. It's been hard because we can't go do it, like, apart from the one lady that I have to go mask up to deliver the food. It's very hard to support them. So it's just over the phone, talking over the phone, speaking to them. But yeah, they're finding it hard, you know.
But that's a great point as well. Who do we know that's already coming into the isolated like you say, especially older adults? If the food industry are already going into them, how do we tap into that food industry in order to get our messages and in order to check how they are? How do we do that? Is it that, you know, for the time being, I don't know, like, we're innovators on this call, aren't we? So, you know, could it be that the food workers are trained up to ask certain questions when they're dropping these things off, to ask them how they are, to then signpost? They get a bit of social prescribing training. You know, is that a way forward?
But the lady that I use, that I tap into, she's actually social prescribe trained. She set up her own agency. She's a good friend of mine. She set up her own agency delivering food. So she's qualified. She does social prescribing as well. So when she does the food, she can offer the both. So I use her for my clients.
Brilliant. Has anyone got any more comments or anything that you would like to say before I think we'll end it there today? Dave, how about you? How have you found the session today?
Really good, actually. It's nice to hear that similar approaches to what I've sort of used in the past that are working, and to expand on those and sort of take learning off you and say, right, actually, maybe I can bring a few things from my previous career into this, and bring people in a way that I'd sort of hadn't been doing. So yeah, just a heartfelt well done. Keep doing what you're doing. You know, it sounds like you're doing a fantastic job.
Thank you so much.
I think for me, it really, you know, it really makes me wonder, you know, actually how sort of human am I when I'm doing some things, you know? Do I need to just be myself a little bit more instead of what I think I should be in the NHS? This, you know, professional, this has got to be this, and we've got to do X, Y, and Z. And, you know, would it actually be that we get there very quicker, you know, if we asked them how they were? And, you know, we really looked at patient education in a different way, more around conversational stuff.
Yeah.
So thanks. Kapila said it's a very helpful webinar. The tips from Rahima about engaging people has been useful. It's applicable in most settings, and I absolutely agree. Thank you. So I just want to say a huge thank you to you, Rahima, because I know you've never done anything like this before either. And you know, I know you were saying thank you to us, but actually we've learned so much for you, and it's great to have you as part of our community. And I'm sure that if anybody wanted to ask you anything further, then you know you support them. But I don't know whether you want to sort of summarise your story day. Clapping. I don't know whether you want to summarise the session today, Rahima, how you feel, or
I just want to say thank you so much to Carla. I feel like I've known you a lifetime, Carla and Molly. Honestly, it's from the first day that I came onto the course, I just felt very uplifted, you know, because you are very passionate about what you do as well, and you listened to me, you understood me, and I felt like you knew me as well, you know, and the importance of the work that I'm doing in the community. You made me feel like very empowered by the words that you use, like, you know, Rahima, what you're doing, you're changing lives. And really reading the messages that I have from the community and what they wrote is so important around the social aspect and social prescribing and the importance it's having on people's lives.
What I would love to see is more people taking your information that you've took years and years to learn and to be integrated into, you know, taking all those connections that you've got and really being able to explore them themselves as well, as other healthcare professionals, and work on that as a baseline of the just support that you've offered all them years to people.
Yeah, and please, Carla, please share my email to anyone if they ever want to contact me. I will answer any queries. And just to leave it on, like, you know, health is so important, and like Dave said, is that, you know, going into the community to help reduce health inequalities, don't do it in a relaxed setting, and just be a friend. I class myself as the friend. Yeah, I wear my NHS badge, but to all them, I'm Rahima, I'm their friend, and they can tell me anything, because of that trust.